The gentleman yields back. The chair is pleased to recognize the ranking member of the full committee, Representative McMorris Rodgers, for your 5 minutes to question.
Thank you, Madam Chair. Mr. Secretary, in February, I asked you and the President for a plan to end the public health emergency, hoping to get information about how to transition 2 vaccines fully approved to commercial distribution and how states can quickly and easily incorporate flexibilities from the pandemic into their Medicaid programs. We didn't receive a response or your plan, but we have received more requests for money. These requests have come without information on how you and the states have spent pandemic funds to inform needs today. I'll note the reports about COVID-19 funds going to fund things like high-end hotel, a ballpark, and ski slopes. Do you commit to following up on your current budget request and also more funding requests to include all assumptions about operations, cases, and relevant existing available funds to all members of Congress and the public?
Congresswoman, we will continue to provide the information that outlines how we have used the COVID money that we've received. We've provided volumes of paper in response to questions. We have done numerous briefings, bipartisan briefings on the expenditures for COVID. We'll continue to do that. The President's plan to move us beyond COVID-19 but stay prepared for any future pandemic outlines in his budget how we would use the money. We're more than ready to brief you as well in more detail because we know we need to be ready.
Yes, well, it's pretty basic, and we need to have those details, and unfortunately, there's a lot of questions that have not been answered. Do you anticipate the U.S. government being the sole purchaser of COVID-19 vaccines for the rest of 2022?
We know that there are other, whether it's nations or there are others who are looking to purchase. We will continue to make sure that we provide the American people with the supply that we need, and so we'll do everything possible to make sure.
Do you have a projected cost?
I'm sorry?
Do you have a projected cost to the federal government?
The pandemic preparedness plan does outline what we think we would need. Remember that if we're talking about getting further supplies of existing vaccines, that would be a different price than if we have to go towards a vaccine that deals with new variants, or if we have to go toward a new vaccine altogether.
Do you have a plan to transition to commercial distribution for vaccines?
That is part of the President's pandemic preparedness plan.
Okay, thank you. I asked last year if there would be any proposals that would give you as Secretary the ability to implement drug price controls using quality-adjusted life years, QALYs. QALYs put a price on a person's life, and the National Council of Disability has recommended against using QALYs. I'm introducing a bill this week to ban the use of QALYs. Do any proposals in the budget require your department to rely on QALYs to make decisions?
Congresswoman, the best I can tell you is right now, nothing that we are proposing would put any limits on the ability of an American to be able to get the best quality care that America can afford to provide.
Does your department use QALYs?
I'm not aware of our particular agencies using anything like that to make final determinations.
Well, I'm pleased to hear that. I hope that you'll look at my legislation. I think it's very important that we clarify and ban the use of QALYs. Finally, because of inflation and surging prices, Americans are paying more for everything, including health care. Empowering them with information on the actual price of health care is more important than ever. Your budget states that, quote, enforcement activities are necessary to drive compliance with price transparency. A recent survey found a majority of hospitals are not compliant with the hospital transparency rule. When will we start to see these enforcement actions?
Congressman, we have begun enforcing that law as of this year. We have issued numerous challenges to some of the providers where we have evidence that they are not following through with the transparency requirements under the law. Fortunately, most of those providers are responding in kind to make adjustments, and we will continue to enforce that law.
Well, I appreciate your commitment to this. I believe it is so important that we're getting this information, and really this is something that has been supported bipartisan, Republicans and Democrats coming together and making sure that we do have this transparency around prices.
Agree.
And finally, I just want to say, as it relates to the budget, it's been disappointing. We've been a bit frustrated that we haven't seen more details on how funds have been spent. But I did notice that you had found the resources to establish an Office of Climate Change and Health Equity in August of 2021. And I also just saw this past Friday released an initiative to lower hospital emissions. I just hope that you will get back to the priorities that have been outlined in a bipartisan way. I yield back, Madam Chair.
Gentlewoman